Hello viewers, welcome back to Practice with Puspen. I am thinking of renaming this as Practice with Dr. Preetha Ghosh because Dr. Preetha Ghosh is the person who most frequently joins me for these practice sessions and is kind enough to let me record these practice sessions to be uploaded on YouTube. Thank you so much, Dr. Preetha Ghosh, for joining me once again. In MRCS ENT OSCE, you either get a single task or you get a composite task, but the total time to perform the task remains the same, 7 minutes. And while performing the task, you neither get an opportunity to check the time, nor do you get an opportunity to check the question once again. So it is very important that you read the question carefully and you don't miss out on any important detail. Sometimes you get 7 minutes as a prep station where you can gather your thoughts regarding how you will approach the upcoming station, but sometimes these 7 minutes are not available. So you have to read the question carefully, remembering well that you won't get any other opportunity to look back at the question again. So read the question properly. Remember, you have to finish in 7 minutes. This requires a lot of practice. That is why you need to practice before MRCS ENT OSCE. So, Dr. Preetha Ghosh, when you are ready, I will stop sharing the screen and I'll start the timer. Are you ready?
Yes, start.
But just for the benefit of the viewers, I will read the question once. A 55-year-old man has had recurrent episodes of epistaxis. Obtain relevant history to arrive at a provisional diagnosis and perform flexible nasoendoscopy. So this is a composite station involving obtaining history and then performing a clinical examination. In MRCS ENT OSCE, flexible nasoendoscopy is performed on a mannequin, not on a live patient, but you have to know how to perform it. And then you have to perform it on a mannequin. So with that out of the way, let's start the timer. So start, Dr. Preetha Ghosh.
Good evening. I'm Dr. Preetha Ghosh. I'm one of the ENT doctors in this hospital. May I speak with you?
Yes, doctor.
Could you please confirm your name and date of birth for me?
I am Tom Anderson and I'm 55 years old.
And how may I address you, sir?
You can call me Mr. Anderson.
All right, Mr. Anderson. I understand that you're having some problem with your nose where you're having recurring episodes of bleeding. Could you tell me in details about it in your own words?
Yes, so I have bleeding from my nose. I've had it for about a month now, and I can't really predict when it will happen. So it has caused a lot of social embarrassment for me. So I was hoping you could help me with this.
Yes, well, I do understand your concern. And so does this, how often does it happen?
It happens about once a week.
And does it happen from just one nostril?
No, either one.
All right. So is it specific? Which one does it happen more, like the left or the right?
Sometimes right, sometimes left. There is no guarantee. Sometimes both.
Specific. All right. And is there any kind of bleeding from your mouth as well?
No.
All right. So do you have any problem with your nose, like any kind of trauma to your nose?
No, the only problem is bleeding.
All right. Or do you have any kind of nasal discharge?
Does blood count? Is blood considered discharge?
No, any other discharge apart from blood.
No.
Nasal obstruction or nasal blockage?
Not really.
Any kind of facial pain?
No.
All right. And have you ever been admitted for these episodes of bleeding, or
No.
what do you do? So have you gone to a GP when these episodes happen?
No, they stop on their own.
All right. I understand your concern. So have you noticed any other problem or any kind of lump in your head and neck region?
No.
Any ear pain?
No.
All right, I understand. Have you noticed any kind of bruise in any other part of your body?
No.
So something about your personal life, I mean to say about your medical history. Are you on any kind of medication for any chronic medical illness? Like
Yes.
maybe diabetes?
Yes, so I've
Yes.
been
For what?
taking medicines for diabetes. I also have bad knees, so I take medicines for gout. I take medicines for asthma. I've been taking medicines for IBS sometimes, and I've been taking medicines for these leg pains I have occasionally. I've had frozen shoulder, so I've been on therapy for that as well. And occasionally I take medicines for cholesterol, and I also take medicines for I had an episode of heart attack few months back, and I've been taking medicines for that as well.
So are you, is there anything in specific, like any kind of blood thinners that you take?
Yes, I do.
All right, I understand. So are you allergic to any medication?
Not that I'm aware of.
And have you had any kind of surgery for your nose?
No. No.
All right. Does any condition that might run in your family?
Diabetes runs in my family. Diabetes.
Sorry?
Diabetes runs in my family.
All right, diabetes. I understand. So something about your personal life. Do you smoke?
No.
Do you drink?
No.
What do you do for a living?
I'm a banker.
I understand. And what are your concerns regarding this, or any kind of ideas that you might have what's happening here?
I think I have cancer of the nose.
Well, I can understand your concern, but please do not be worried. We will try our best to come to a diagnosis and help you with the best of your abilities. So to sum up, you're having nasal bleeding for about 1 month, which happens from either of your nose, but no nasal discharge or any obstruction or any kind of facial pain or any lumps anywhere. But you have a lot of chronic medical illness, like you have diabetes, you have a heart condition, and you have leg pain and gout and IBS, right?
That is correct.
So judging from your history, I feel that these bleedings are occurring because of your deranged blood clotting factors, because you're taking blood thinners for your heart condition. That is one of my diagnoses. The other there could be any kind of nasal pathology, like there could be nasal polyp or recurrent sinusitis, which could be there. But to come to an exact diagnosis, I have to perform something known as a nasal endoscopy, where I will be inserting this endoscope through your nose. Would you like me to tell you in details about it?
Yes.
So firstly, I will sanitize my hands and wear the gloves, and then I will check the light of the endoscope, and then I will defog it by dipping it into Savlon and apply a jelly over it, which is a numbing jelly. And I will also spray a numbing spray into your both nose, both nasal cavities. And I will slowly introduce it through one of your nostrils, whichever you prefer first. And once I do that, I will look at your nose, at the back of your nose. Then I will proceed down to your throat. I will look at the back of your throat and also at your voice box. So this will not be painful. If you feel uncomfortable, tell me. I will stop the procedure. So when I'm at your voice box, when I say ah, please say ah. When I say e, please say e. When I ask you to puff your cheek, please puff your cheek. And when I ask you to protrude your tongue, please do that. And once I have a look, I will slowly withdraw it and look at the other nasal cavity. Is that all right with you?
That sounds fine. But the spray, will it
All
not?
right.
How long will the effect last of the spray?
It will last for about half an hour to 1 hour. So please avoid any kind of hot drinks or any kind of hot food after this procedure for about an hour.
So that is the time. I think it was a spectacular effort. Just a little bit of refining and you will be very good at what is admittedly perhaps the most difficult station in MRCS ENT OSCE. You did very well, but just a little bit of refining is required. Very well then, Dr. Prisa Ghosh. Thank you for letting me record this video and subsequently upload it on YouTube. Take care. Bye-bye, Dr. Prisa Ghosh.